Hello everybody. Today our topic is ulcerative colitis. Ulcerative colitis is a chronic inflammatory bowel disease which has a relapsing and remitting course. Ulcerative colitis is categorized according to the location. It's called proctitis, which involves only the rectum. Proctosigmoiditis affects the rectum and the sigmoid colon. Left-sided colitis encompasses the entire left side of the large intestine. As for the pancolitis, inflames the entire colon. Inflammation is confluent and is more severe distally. In long-standing pancolitis, the bowel can become shortened and pseudopolyps develop, which are normal or hypertrophied. The inflammatory process is limited to the mucosa and spares the deeper layers of the bowel wall, so it's related to the mucosa. What is the major symptom of ulcerative colitis? The major symptom is bloody diarrhea. Emotional stress, intercurrent infection, gastroenteritis, antibiotics, or NSAID therapy may all provoke the relapse of ulcerative colitis. What is the cause of ulcerative colitis? As we've mentioned, this is a chronic inflammatory bowel disease. The cause of ulcerative colitis is unknown. People with this condition have problems with the immune system, but it's not clear whether immune problems cause this illness or not. Note that stress and certain foods can trigger symptoms, and they do not cause ulcerative colitis, but they trigger the symptoms of ulcerative colitis. Ulcerative colitis may affect any age group, peaking at ages from 15 to 30 and then again at ages 50 to 70. The disease usually begins in the rectal area and may involve the entire large intestine over time. Risk factors include a family history of ulcerative colitis or a Jewish ancestry. What are the symptoms of ulcerative colitis? The symptoms vary in severity and may start slowly or suddenly. About half of the people have only mild symptoms. Others have more severe attacks that occur more often. Many factors can lead to attacks, including respiratory infections, physical stress. Let's mention these symptoms. These symptoms include 1. Abdominal pain and cramping that usually disappears after bowel movement. 2. Abdominal sounds, splashing sound heard over the intestine. 3. Blood and pus in stools. 4. Diarrhea, from only a few episodes to very often throughout the day. 5. Fever. 6. Tenesmus, which is rectal pain. 7. Weight loss. 8. Children's growth may be slow. What about other symptoms that may occur with ulcerative colitis? And these include a gastrointestinal bleeding, pain felt in the joints, mouth ulcers, sores, nausea and vomiting, and skin lumps or ulcers. What about the exams and tests, the investigations that should be performed to a patient that comes with ulcerative colitis? First, colonoscopy and taking biopsies is generally used to diagnose ulcerative colitis. Other tests that may be done to help the diagnosis of this condition include barium enema, complete or full blood count CBC, a C-reactive protein CRP, and an erythrocyte sedimentation rate. And all of these, they appear in the CBC. Ulcerative colitis increases the risk of colon cancer. If you have this condition, which is ulcerative colitis, you should be screened with colonoscopy after 8 to 12 years after being diagnosed. You should have a follow-up colonoscopy every 1 to 2 years. What about the treatment of ulcerative colitis? The goals of the treatment are to control the acute attacks, to prevent repeated attacks, and to help the colon heal. Hospitalization is often needed for severe attacks. Diet and nutrition. Does diet and nutrition play a part in the treatment of ulcerative colitis? Certain types of food may worsen diarrhea and gas symptoms, especially during times of active disease. Diet suggestions for a patient with ulcerative colitis, these include that he or she eats small amounts of food throughout the day. Drink plenty of water. Avoid high fiber foods like brands, beans, nuts, seeds and popcorn. Avoid fatty, greasy, fried food and sauce like butter, margarine and heavy cream. Limit the milk products if you are lactose intolerant, malabsorption disease. Dairy products are a good source of protein and calcium. Thank you for watching and looking forward to see you in the next video with a new topic.